Hello, and welcome to this episode of Little Bits of Stuff, a podcast that showcases different health-related topics for medical professionals and non-medical audiences. This show is brought to you by Nick Ate, a surgical resident at University College Hospital, Ibadan, Nigeria. And here's your host, Nick.
Hello guys, in this episode, we'll be exploring what the public's rights are as a patient. Have you been to the hospital lately and felt like you didn't know what to do, you didn't know what to say, how to communicate, what to expect from your doctor, what services to expect from the facility, and how to follow up on your own care? Have you heard about the Patient's Bill of Rights? Do you even know your rights, or you just go in with the doctor save me attitude and forget the rest? So today we'll explore the public's rights as a patient when you get to a health providing facility under several headings. Your rights, your responsibility as a patient, you have your own responsibilities too, and the provider's responsibility to you as a patient. I will break this down as much as possible and drive it home with some few points for the closing. So let's drive right in. Now, the Patient's Bill of Rights was developed by the Consumer Protection Council, the CPC, with other stakeholders and the Federal Ministry of Health. The Patient's Bill of Rights is an aggregation of patients' rights that exist in other instruments, including the Constitution, the Consumer Protection Act, the Child Rights Act, Freedom of Information Act, National Health Act, the Hippocratic Oath, other professional ethical codes, and sundry regulations. Now, with regards to access to information, what are your rights as a patient? Now, you have the right to access all relevant information when you get to a health facility in a language that you understand, including the complete and accurate information about your diagnosis, your treatment, prognosis, and other procedures and possible outcomes. You also have the right to fully participate in implementing the treatment plan and making decisions. So you don't just go to the hospital and just sit back and then hear the doctor or hear whoever is talking to you about your treatment and just decide to keep mute, or decide to just feel like the doctor save me attitude. Okay, just whatever is good, just give me the treatment, and all that. You don't just sit back and let that happen. You may be helping whoever is talking to you to make the wrong treatment plan that doesn't actually suit you. You need to communicate. You need to make your opinions known. So you need to have a proper grasp and understanding of what you're being told and what it means in the real sense of it. So these are your rights as a patient. You have the right to access all the information. If you do not understand it in a particular language, you can demand for it to be explained in another language of your choosing. You can be reasonable about it, and you can also beg for an interpreter or a translator if the need be. And again, when it comes to implementing the treatment plan, you have to be fully involved. Don't just sit back and allow the whole thing to just go right past you without even having a say in what happens to you. What are your own responsibilities? Like we said before, you do have some responsibilities. You must understand the treatment plan. It's on you to understand the treatment plan. It's on you to also seek information from the caregiver about your service, about their services, Now, if you're not clear about anything, the responsibility is on you to say, oh no, I don't get this. Can you come over? Can you come again? I don't understand this. Can you, explain to me? Can you paraphrase? Can you do this or that? I mean, if you even want to go as far as illustrations, anything that works for you, it's your responsibility to make this known. You cannot, at the end of the day, say you don't understand when in fact you did not make it known that you do not understand. Hence, it's the responsibility of your health provider to give you all the information you need. So you get how it goes now. It's your right to know to have access to all the information about the services that are available to you, the information about your health, your treatment plan and everything. And it's your responsibility to totally understand that. And it's the responsibility of your provider to explain all this to you. So he's not doing you a favor by explaining all this to you. He's not doing you a favor by telling you what you need to know. It's your right as a patient to actually have all this information. And you need to have this at the back of your mind when you go to a hospital or when you go to a health providing facility to, actually, have the opportunity to, get all this information that you need. It's a total waste of time when you go to a facility and then you come back the same, more or less like you just, went to consult a sorcerer or something like that, or a prophet. It doesn't work that way in a health facility. It has to be, a client provider kind of, relationship where both are on the same page. Else things won't work fine. So it's the responsibility of the health provider to inform the patient about services that are available at the facility and the eligibility based on the health insurance or even out-of-pocket payment costs and responsibilities. Now, it's also the responsibility of the health provider to inform the patient whether the proposed treatment or procedure is experimental or part of an ongoing research. And now, it's the responsibility of your health provider to answer questions about the proposed treatments and procedures, provide other information about the risks associated, the alternative treatments available, and even the alternative procedures available. It is your right to also know these things. So it is the responsibility of the provider to give you all this information. Okay. And it is also the responsibility of the provider to provide the patient's medical records on request by the patient or other authorized persons in accordance with the prevailing laws. So this just, talks about, like we said, your rights, your responsibilities, and the provider's responsibilities all in one bundle under the access to information. So let's move to the next point. Patient-related information. What are your rights to patient-related information? Now, you have the rights to access the records, about the range and scopes of services that are available to you. Okay? You have the right to access the record of the identity, the skills, the credentials of, the people treating you, and the care providers, published by the Federal Ministry of Health and other relevant authorities. You have the right to know, is this person treating me the correct cadre or the correct, has the correct qualifications, and things like that. Okay, so you have the right to access the records of the identity, the skills and credentials of, the treating professionals, that are involved in your care. Now, what are your responsibilities, under patient-related information? Now, your responsibility is to request information about the range and scope of services available, including the identity and the credentials of treating professionals and care providers. It's your responsibility to ask. You can't just, assume that, it must be given to you, even if it must be given to you. But I mean, if it happens that it was not provided, you should ask. It's on you to ask, to know, is this person, this or that, or okay, this is the kind of person I want to see. Is this available in this facility? Oh no, I don't want to see this kind of doctor. No, I want to see this kind of doctor, and things like that. And you can usually work this out, between you and the, health provider. Now, the responsibility of the health provider in this case is to, conspicuously display the scope of practice, and available services and customer care phone numbers, email addresses, and other contact information that is available in that, hospital, in that health facility. Okay, and they're also responsible for communicating with you, in clear terms, including providing translations, like we said the other time, in the case of language barrier, or adaptation in the case of other disabilities. Okay, and it's the responsibility of the provider to ensure that patient demonstrates, sufficient understanding of the information provided. A lot of times in the clinic, you explain a treatment plan, and you tell the patient to, try to explain, even in their own words, what they understand by what you just told them. It's more or less like a kindergarten thing, but you want to know if your patient, if your client understands what you just told them, if they understand what you're about to do for them. It's not out of place, for you to try to get that information out. A lot of times you ask a patient that and they tell you totally different, or you ask the patient to repeat what you just said to know if it actually, if it's actually going to stick. And you have to go over it and over and over and over, within reasonable limits, until the patient totally understands, what you're talking about. Is the responsibility of the health provider to provide sufficient identification when on duty, including displayed rosters and apparel, with visible identity tags. So for a doctor, for example, you have to either while on your scrubs or your ward coats, while even on mufti, at least you should have an identity, that displays that, oh, okay, this is a doctor of so department, so cadre, and things like that, just so you don't, confuse, your client. And then, from there, they also gain more confidence and things run smoothly. Now, fee-related information. Okay, what are your fees? What you're supposed to pay, and things like that. Now, for your rights as a patient, okay, you have the right for a full disclosure of cost or estimation of recommended treatment plan, services. And this must be transparent and it must be itemized. There's nothing like, oh, okay, so everything will cost, this. Oh, okay, so just bring 50,000 naira and we'll do this for you. No, there must be an itemized billing as to what you're paying for, to the nitty-gritty details. There's no total balance here, just a total balance and then you go away. No, you must request for an itemized billing that shows everything in terms of services that you have paid for. It's your right, not your responsibility this time around. It's your right to actually request for that. Now, as regards your responsibilities, You must pay bills. It's non-negotiable. You must pay bills or make provision for prompt payment of bills. In the event of an emergency, demonstrate ability and intention to pay for the services. You don't say because it's an emergency, then, it's not an opportunity for you to get free services. It's an emergency, yes. But even if you don't have to pay, at that particular point in time, let's assume it happened in the middle of the night, there was no money at home, then you take a patient to the hospital, you're not insured. You practically have nothing. As the treatment is ongoing, you must also make efforts to show that, you're willing to pay. Some patients, during these emergencies and all that, just because they don't want to pay, they start causing trouble and things like that. That is not the way to go. You must be calm about this. You must actually, show some, some attitude that depicts that you want to pay for these services. But, now you don't have it on you. Now you don't have it at all. But you're willing and you're going to look for how to, get some money and then pay for the services when all this is done. You don't just, feel like, oh no, it's an emergency. Yeah. So you guys should just get a free treatment and go. It doesn't work like that. It doesn't work like that anywhere. Or well, at least in Nigeria. So you should have, something to actually prove that you're going to pay. So the responsibility of the provider in this situation is that in the event of an emergency, you should provide immediate and sufficient intervention and care, prioritizing such needed attention over other factors, including cost and payment. Now, that being said, care providers have a right to fees and therefore should use legal means to recover fees owed. Now, so you can understand, when you display an attitude that shows that you're not ready to pay for services, you can be sued, you can be taken to court, the health facility can use whatever means legally available to them to get their fees, to get you to pay the fee, so that the services can keep on running, so that someone else can come at another day and get interventions and get services. Okay, so if it's free for everybody, if it's free and nobody is paying for it, the government is not paying for it, your insurance company is not paying for it, just imagine a situation whereby everybody now uses up what's available in the hospital. So the next person that comes in an emergency, what does the person use if it has not been replaced by someone who paid for it earlier? So it just makes logical, it just makes sense. It's logic, really. So we understand that, you may not, be buoyant at that time. We understand that, things are hard in the country and things like that. We're all in the same country. Pay your fees or display an attitude or demonstrate an ability and intention. That's the key word there, intention to pay for your services. So now that's that's a lot of talk on that. So as regards confidentiality, you have a right to privacy and confidentiality of all information you have provided and all medical records, unless this disclosure is vital and in the interest of the public health in accordance with the prevailing law. So nobody, and I mean no health provider, should actually disclose your information to anybody. It's part of the job description that you must not disclose information to anybody, regardless of who the person is and all that, except it's in the interest of public health. Okay, so someone just tested positive for Ebola virus, for example. Okay, someone just tested positive for SARS, or something that if it gets out there, millions of people get infected and die, things like that are public health concerns. There are situations where you have to report to maybe the federal ministry or a particular health organization that is concerned. That is appropriate for that particular issue. So your privacy, your confidentiality is your right. You cannot be examined in the open. You have the right to say, no, I want to be screened. No, I want a private procedure room. No, where it is available. I want this or that. You should make, requests, about it. On the other hand, your responsibility is to give complete, truthful, and accurate disclosure of your medical history. And now this is where people say, you don't lie to your doctor. You don't lie to your health provider. It's going to bite you right back in the ass. You don't tell things, you don't tell tales that are not accurate. It won't work for you. Okay, what have you been using? Any medications, and things like that. Your responsibility is to give accurate disclosure of medical history, medication, and complaints to the authorized and attending caregiver. You cannot, be back and forth about that. It has to be accurate, precise. That is what is required of you. That is your responsibility. Okay? The provider's responsibilities are, of course, to respect and maintain the patient's personal records, except disclosure, of course, like we said, is required by operation or by law in the interest of public health. As regards quality of care, we're moving on. Your right as regards quality of care. This has always been part of the reasons why doctors, health providers in the country go on strike and all that. Of course, you have the right to access to clean, safe, and secure health environment. There's no point coming to the hospital with one thing and going back with another thing that's almost even totally worse. Okay, you have to have a clean, safe, and secure environment, as a health facility. That is a right. That is a patient right. You have the right to complain, about the environment, to complain about anything that you feel is unsafe, in the health facility where you have gone to access care. You also have the right to access to equitable quality care, and caregivers, irrespective of disability. Okay, now what are your responsibilities, under this quality of care? You need to be able to explain, during treatments when necessary. You don't, constitute, a nuisance or in any way endanger others. You don't, get an information and then you start, shouting and, running around, and all that. You cause chaos, you cause, danger to others, and, a lot of things can happen in the course of that event. Okay. So what are your provider's responsibilities? I'll just, tell you briefly, about that. The provider's responsibility is to maintain records of personnel's current certificates and or license to practice, because it's the right of the patient to be treated by a caregiver who is appropriately licensed, who is not a quack. That's just what that means, and who knows, what he's doing, who can definitely, give you the treatment, the quality of care that you need. Okay, so the health provider must also maintain standards as regards to the cadre of the caregivers that they keep, and they must be able to deliver care that minimizes risk and harm to patients, including preventable injury and errors. So occupational hazards and all those things must be eliminated at the workplace. This can also constitute harm to the patients and all that. They must adopt a clinical governance standards and provide the best of care while protecting patients from harm or abuse. This does not really need any explanation. Now, as regards the patient's dignity, a patient has the right to be treated, whether alive or dead, with respect, dignity, without prejudice to gender, religion, race, ethnicity, allegation of crimes, geographical location, disability, or socioeconomic circumstances. Okay, so whether it's a prison inmate, whether it's black or white, whether you've been suspected of having committed murder, whatever it is, you deserve the right to be treated with respect and dignity, without prejudice. That is the minimum requirement, and it is your right to healthcare, under these circumstances. Okay, so prior wishes of the patient, or in the absence, of same, meaning that when the patient, does not have a prior wish, okay, the next of kin, are respected to the fullest extent practicable, during the event of death, and things like that, including cultural or religious preferences, to the extent consistent with extant laws, including coroner's laws. So, of course, we want to respect your cultural wishes, but at the same time, if this is a coroner's case or not, you also have to respect, the laws of, the constitution, the government, and things like that. So it's your responsibility to also respect, and consider the rights of other patients. Okay, so take for example, there was an aggrieved patient one day, and I was attending to another patient, and it happened that this patient came around to say I should not attend to any other person except his demands are met, and caused a whole cacophony and all that. Of course, the relatives of the patients I was attending to told him to calm down or they will descend on him, because their relative was in a very, dire, very bad state. And, he was disrupting, services that I was rendering to their patient. I didn't even know where the other patient came from, the other patient relative came from. I didn't know his grievances. I didn't know what it was. I was gloved. There was blood, and things like that. So you cannot, that is him not respecting and considering the rights of other patients to healthcare. Okay, so you cannot, as a matter of fact, constitute a nuisance. Like we said before, you need to understand that you're in a health facility. You need to channel your interactions, to the appropriate quarters. You need to conduct all interactions with consideration and respect for others. Okay, that is your responsibility. Now, the provider responsibilities under this is that the provider must treat patients' human remains and tissue samples with care, consideration, and dignity without prejudice to gender, religion, and all the things we said before. Okay, there must be comprehensive information, guidance, and support to bereaved relatives. Okay, they must counsel and encourage patients on the disclosures of disease of public health importance, whether it's deadly, infectious, or it's non-infectious disease, to the spouse or close relatives in accordance with public health laws. Okay, so now we come to emergency care. The access to emergency care. What are your rights as a patient? You have the right to receive urgent, immediate, and sufficient intervention and care in the event of an emergency, prioritizing such needed attention over other factors including costs, payment, as well as law enforcement requirements, like we said before. Now, your responsibilities is to recognize that emergency treatment and prioritization do not mean a waiver of obligation to pay for services. We already discussed this in the fees segment. Okay, so this just goes on to buttress that. Okay, the provider responsibilities is to immediately evaluate patients with medical emergencies, including prioritization where possible. We also talked about this earlier. To maintain a sufficiently responsive and efficient 24-hour uninterrupted emergency unit in the facility. That is just straightforward. As regards visitation, we all know you want to stay with your loved ones in the hospital. You want to see your loved ones. You want to gist with them. You want to pray for them. You want to encourage them. You want to serve as a support system for them in the facility. Now, your right, okay, is to receive visitors, okay, including for religious purposes according to the rules and regulations laid down by the facility. That is your right. You should be able to receive visitors while in the hospital. Okay. Your responsibilities is to recognize that healthcare facilities are for several people, not just for you. I'm sure you know where this is going. So as such, you respect operational rules and systems for the safety and security of all. Okay, your church members came to greet you on your sick bed. It does not give them the leeway to bring their keyboards, their drum sets, the guitars, plug it into a light, into a socket, and just hold the service there. You're not the only patient in the hospital. Okay, so the next person, the next bed to you may just, not like that. So you have to recognize this, and as such, respect, the operational rules. Of course, no hospital would allow that. Okay, no hospital would allow you to come in and then, start, causing so much noise, and things like that. So you have to also respect the fact that healthcare facilities reserve the right to modify rules to maintain decorum and ensure security of patients and caregivers, provided reasonable notice of modification is given. Okay, so these are your responsibilities, okay, that you owe to your provider. Now, the provider responsibilities in these regards is to inform patients and relatives of visitation rules upon admission and any subsequent modification, and to conspicuously display visitation rules and the schedule of the facility. This is obtainable in most places I've been to. You see visitation times. These are the times that you can come in, and these are the times you need to go out. And even at that, they still almost have to chase relatives out at the end of the day. So you have to respect these things, and we all have had loved ones in the hospital, and we know how much we want to stay with them and all that. But in all this, you have to respect the facilities rules and regulations in these regards. Now, patient's refusal of care. I know a lot of people would want to hear about this. Now, you have the right at all times, and I mean at all times, and to retain the control, of treatments and you have the right to be informed of your power to decline care, upon full disclosure of the consequences of such decisions. What I'm trying not to laugh is because a lot of times you see this happen. Patient just wakes up one day, whether having gotten an information from somewhere or is tired and all that, and says, no, I don't want this treatment anymore. No, I want to go receive treatment elsewhere. No, I don't even want to receive treatment. I just want to just enjoy some time with my family at home and die. Whatever it is, we sit them down, we counsel them, we tell them about the consequences of stopping treatment, or the consequences of doing this or that, and at the end of the day, it's either they take your counsel or they don't take your counsel. And I remember a friend of mine usually says, at the end of the day, when they don't take your counsel, you just have to let them leave. I mean, the hospital is not a prison. He usually says the hospital is not a prison. So if after all has been said and done, you still decide that you want to leave, you have the right to leave. Nobody would hold you down. Okay? So patients have the right to consent or decline participation in medical research, experimental procedures, or clinical trials in the course of their treatment. Okay, so it just goes back to what we said before. If a provider have to include recruit a patient for a research, you must inform the patient of what you're about to do, and the patient has the right to say, no, please just give me the conventional, already tested treatment and let me be. You have the right to decline any treatment. You have the right to leave the hospital. You have the right to do whatever you think is best for you. Okay? The patient's responsibility in this regard is to comply with rules and regulations of the facility, as well as directives, instructions, and advice of attending professionals. Now, for the provider responsibilities, of course, if the patient is a minor, that is less than 18 years in our environment, you must recognize that this patient is still under the care of parents or guidance, whose consent must be secured in clinical management and procedures to the extent permitted by law. So, of course, a 16-year-old or a 12-year-old cannot just get up and leave, for example. He must, have had some conversation with the parents, and the patients must agree to actually, determine what the next course of decision would be. So you don't hear from a patient, from a 13-year-old that, I don't want to take treatment anymore. The parents or the caregiver or the guardian have to actually be in the know, and also have to agree to the fact that, we want to stop. We want to stop. We agree with him. We want to stop all treatment. We want to go, and things like that. So all medical research, experimental procedures, or clinical trials must comply with approved ethical procedures as the standard. And of course, as much as we say you have the right to leave, the provider may detain patients in the interest of public health, like what happened with the Ebola patient and the doctor that died in the process. God save us, so rest in peace. You have the right to actually detain the patient if you think this patient will go out and infect millions and kill others, for example. So that is, again, logical reasoning, although a lot of people don't understand that, but it just makes sense that way. We don't want to kill others, do we? Interruption of service by the provider. Let's assume there's a strike. The patient has the right to be informed about impending interruptions, or disengagement of services or of primary or attending professionals responsible for the patient's care. So, and in this method methodical and practical transition of treatment for patient safety and continuity of care must, happen, must be maintained. So a patient has the right to this information. So the healthcare providers are going on a leave, they're going on strike next week Monday. The patient should know today, not just waking up on Monday and discovering that, so I'm alone, so I'm to be discharged even though I'm not fine, so nobody's going to take care of me, this or that. The patient must have information beforehand to actually be able to make informed decisions about their own care too. So it's your right to know. So if this happens, it's the patient's responsibility to inquire about any contingency plan or other suitable alternatives with respect to continuing care. So you also don't just sit back. I keep mentioning that you don't sit back and just let things happen. You have a responsibility on your hands. You have to know what to do. You have to know what is required of you. So it's now the provider's responsibility to reschedule patients' appointments in the event of inevitable service interruption, to render sufficient intervention to inpatients and emergency cases in the event of inevitable service interruption. So lastly, but not the least, complaints. What are your rights? A patient has the right to express dissatisfaction regarding service and or provider, including personnel changes and abuse. So whatever you think is not right, you have the right to complain. Whatever you think is not adequate, you have the right to complain. Whatever you think is blah blah blah, you have the right to complain. You must also, however, be able to complain in accordance with the redress mechanism of the facility, not just shouting, not just causing a whole lot of noise and all that. You have a complaint, there are proper channels to go through, and you have to also provide sufficient details of your dissatisfaction. So again, if you're still dissatisfied with the outcome of your complaint, you can take a step further to report to appropriate regulatory authorities. Take for example the MDCN, the Consumer Protection Council, and all that. So these are essentially your responsibilities, to yourself and to the public. You have a complaint, complain about it, take the proper channels, and it makes sense from there. Now the provider responsibilities are to encourage patients to ask questions about their services and to maintain a record of complaints and redress procedure of the facility, and address complaints in accordance with procedure. And it's their responsibility to inform patients at onset of the redress mechanism provided by the facility and regulatory bodies with timelines for action on complaints. Servicom is an acronym for Service Compact with All Nigerians, established in 2004. And is an initiative of the federal government of Nigeria conceived to promote effective and efficient service delivery in ministries, departments, and agencies to ensure customer satisfaction and to manage the performance expectation gap between government and citizens, as well as other members of the public on issues of service delivery. So in most hospitals I've been to, especially government hospitals, you see a Servicom logo. They're always there. If you have any complaints, if you have any problems, you're satisfied, you have grievances, you think nobody's listening to you, there's someone, there are people, there's a department that you can complain to. Servicom is always there to take your complaints and they will address it. in manners that are according to the law. So, in conclusion, I'll just take a recap of every segment we talked about. Patients' rights to access to information, patient-related information. Thirdly, fee-related information, patients' right to confidentiality, patients' rights to good quality care, quality of care, patients' dignity, access to emergency care, visitation, patients' refusal of care, interruption of service by provider, and lastly, complaints. If you have any clarifications you'd like to make, if you have feedbacks, if you have any contributions, any comments, please kindly do so on our social media handles that are available to you, and we'll get back to you almost immediately. This brings us to the end of this episode. Join us on the next episode where we'll talk about more interesting things to come. Have a nice day.
And that's it on Little Bits of Stuff for today. Please subscribe to our podcast on iTunes or Google Podcast. You can also get it on Audio Mac and YouTube. Follow us on Twitter at Lil Bits of Stuff. That's LILBITSOFSTUFF. And on Instagram at Little Bits of Stuff. That's LITTLE Bits of Stuff. Until next time, stay healthy.